the risks of contraception, and especially there are rumors that that if you take if you're on the pill for too long, you might do yourself some damage?
Well, that's a myth, and we need to get rid of that particular myth. And when we talk about the pill, we should also be thinking also about the patch and the ring, because the patch, the ring, and the pill are contraceptives that can contain both estrogen and progestin. So you should consider them one class as it relates to the hormones and one class as it relates to side effects and what you are referring to, which are serious adverse events. The serious adverse events are things like heart attack and stroke and clots in the legs, and they are extremely rare. In fact, when you compare those type of serious adverse events that can occur during pregnancy or postpartum compared to what you see on, among a population of women that is on the pill or the patch of the ring, you find that you have actually double the amount among pregnant women and more than triple the amount of, say, blood clots if you're looking at a population of women that are immediately postpartum. So in essence, the bottom line is we have to put these risks into perspective. There's no medication that is completely risk-free. In fact, the aspirin, the Tylenol, whatever you buy over the counter is associated with potential risk. The point is that the risks are very, very small among healthy reproductive aged women. And if you are a woman that has a chronic disease or illness, then you still probably will be able to safely use most forms of contraception, yet you definitely will need to be followed fairly closely by your healthcare provider.
Now, is the typical health care provider be that person a clinic, a private clinic, or a publicly subsidized clinic, or a private doctor? Will they tend to have that full array of contraceptives that you've been talking about?
Fran, that is actually one of the problems that we have in this country, and that is that we have a fairly wide array of contraceptive options, yet many women don't really have access to those methods. And in fact, this is one of the reasons why healthcare reform is so very, very exciting.
Yeah, the legislation that was just passed?
The legislation that was just passed, the legislation that we have needed for years and years in this country, because contrary to what you hear on C-SPAN, we are not in good shape in terms of our healthcare system in this country. And in fact, if you look at some of the leading indicators, such as infant mortality and maternal mortality, and compare us to similarly developed countries, such as those countries in Northern Europe, the Netherlands, Sweden, even looking at Great Britain and Canada, we rank far below those countries in terms of our overall healthcare status. And a lot of that really has to do with the fact that people lack access to general health care services, and more specifically when we're looking at reproductive and sexual health, there are many women in this country that do not have access to the full array of contraceptive methods. It's insurance, Fran, and that's the reason why the health care reform is money. It's money. And having coverage for the contraceptive methods that are all FDA approved. And so the hope and promise of healthcare reform should be that, first of all, you have about 32 million people who were previously uninsured that are now insured, and those women who become insured will now have access to the full array of FDA-approved contraceptive methods.
So that's a given.
It is not a given. It is definitely a possibility through the way that the legislation was written and by the Women's Health Amendment that was spearheaded by Senator Mikulski, our old Senator Mikulski. And I shouldn't say old, we're saying old because, you know, we were in Baltimore, and we're proud of what has gone on in Maryland and through Senator Mikulski. Now, Senator Mikulski and others have put provisions in place in this healthcare reform bill such that women's healthcare services, and specifically women's preventive healthcare services, will be covered. So we're talking about not only contraception and family planning, we're talking about cervical cancer screening, we're talking about breast cancer screening. But the key here is that the devil is in the details, and the implementation must protect family planning as part of the preventive health care services, such that women and men in this country who will become insured under health care reform will not have to have a copay. See, preventive services, as classified through HHS, Health and Human Services, will not be subject to a copay. And truly, in my opinion, that's the way to really increase access for preventive services that are classified under the title of preventive services as defined by Health and Human Services. And in fact, the definitions are going to be really determined in major part by those particular services that are recommended or highly recommended by the U.S. Preventative Services Task Force.
Now, so that the determination of what is properly going to be called preventive service will be a federal determination. It won't. Somebody in New York will be as covered as California.
We don't know that. We don't know that.
Okay, sorry.
And Fran, and you're hitting it all, because this is where the devil is in the details, and where all of us need to watch what is going on. And in fact, Planned Parenthood worked very hard to ensure that contraception would be considered a part of preventative health services. But this is only the first step, and we will be really watching closely and working very hard to make sure that we don't lose contraception as defined as a preventive health service that does not require a copay.
Excellent. This might be sort of what you were talking about before, but there was an article in which you were quoted in the Wall Street Journal back in the end of April called The Birth Control Riddle. And it was basically talking about the 50th anniversary of the approval of the pill. And it stated that almost half of the pregnancies in the U.S. are unintended today. And that assertion is undergirded by Guttmacher's finding that nearly 59% of women who are in need of subsidized family planning aren't getting that care. Why not?
I think we alluded to it before, especially as it relates to insurance coverage and having access to contraceptives. But the reason why people aren't getting easy access to contraception and also family planning services tends to be rather complex, and a lot of it is kind of tied up in the rules around insurance and some insurance plans. I want to go back a little bit into the issue in terms of unintended pregnancy and the fact that for the past 2 to 3 decades, approximately 50% of all pregnancies that occur each year in the United States are unintended. That is indeed true, and it just points to the fact that we, people in America, tend not to use contraception as consistently and as correctly as our counterparts in other countries. And it points to the fact that even though each year about 50% of pregnancies are unintended, if you look at what's called the total fertility rate, which is the average number of children that a woman will have during her lifetime, if we look at that number tends to be 2. So putting the two together, you know, that over a woman's lifetime in the United States, the average number, whether you're talking about black, white, Hispanic, is 2, no more than 2.7, 2.8. The issue here is mistimed pregnancies for the most part. Once women, it appears that once women have achieved that number of 2, then they tend to not have any more children, and that's one of the reasons why we see such a high rate of sterilizations, whether vasectomy or tubal sterilization in this country.